So, I'm sure, I think 2020 is definitely, without question, is going to be remembered for COVID. I think that's clear. I think the thing that will probably have the similar and maybe even more of an impactful ripple in the long term is just all the conversations that we're having about systemic racism, different ways of empowering, calling things out for what they are. And I know this is something you've helped us a lot with. My mind wonders, what role do you see PCBH having within this conversation about systemic racism, helping medicine and primary care? What role do you see primary care behavioral health playing in this?
And Dave, I'm so glad you asked this question because I think that's something that we've continuously tried to figure out as it goes on, and I do think that COVID has allowed us to have more power behind this conversation, just because with the drastic health disparities and how we see it disproportionately affecting people of color. And my answer to that is that I think that primary care has always had the potential to be at the forefront of this conversation. And that's because you hear that we are the closest to the community. We serve the community. And if we think about what primary care was meant to do, it was meant to serve the needs of the community. And so as we've been kind of stuck in institutional racism, our models have been also stuck in that as well. And so if we think about what primary care can do, we can talk about how taking a social justice stance, impacting the larger community, because that's who comes into our clinics. And so if we can start to be a place where not necessarily we shut down conversations about race, but invite them, and be willing to give knowledge or education or have hard conversations, then we can kind of spread this idea that we are here to serve all people, and that for a long time we have not been serving everyone. And when I think about this, and I think about the parallel to Black Lives Matter, right? When I say all people, I almost have a gut reaction like all lives matter. That for so long, and because of the institutional racism, we have not been serving our minority population. And that now we need to focus on equity, inclusion, and diversity. And I think that primary care is a place to do that, because there are so many people here from within our staff, within our community population, that these are where tough conversations can be had. This is where we can, because of the culture of primary care and how close-knit we are, we can feel comfortable in potentially, I always hate the word calling out, but bringing awareness to what's going on, because if we look at these things, they might be outside of our awareness or inside our awareness, but we also have to be in a place where we can stop, reflect, and be comfortable about being wrong.
It's an interesting thing, right? That primary care, in a way, the way primary care is set up to serve the community, can be a great venue for us to really not only have these conversations, but I love what you said about reach the communities that have absolutely been underserved and low access, not only for behavioral health, that's well documented, even for primary care and health services.